Being a NACHC member is part and parcel of being able to be part of a successful community health corps program, or to sponsor a successful community health corps program. And sponsoring a successful community health care program is going to help you with all of your outreach efforts, not just through the community health corps program, but through all of your volunteerism program. There's systems in place that you can take advantage of, resources that are in place that you can take advantage of, all of which becomes available to you by virtue of your NACHC membership and your community health corps sponsorship. We have several staff that were community health corps navigators that have transitioned into being full-time or paid staff of our health center. Most notably, the one that comes to mind first is our community health corps program coordinator, Krishanta Evans. Krishanta is amazing. She did a 2-year member term with us in our community health corps program, and then the opportunity to become our program coordinator came up, and she's just done a marvelous job. We've really only been a community health corps sponsor for 5 years now, and Krishanta has led that program for the last 3 years. But in addition to Krishanta, our director of nurse training, BJ Kachera, she started out and did a 2-year term as a community health corps member, and went on with her education and got her CNA and her LVN and her RN, so now she's our director of nurse training. She does a great job. We probably have 2 or 3 nurse aides that have gone through the health corps program, several other support staff. We're still working on getting our first, let's say, professional, our first dentist or a physician to go through the program, but I think that's coming up pretty soon as well. Having the community health care program at our center, it is truly the heart and soul of our outreach efforts. I mean, we have 20 members. We're a rather large community health corps program, and we're just really out touching the lives of so many people in our community with the health corps program. We do chronic disease management, in particular diabetes self-management programs with our patients. We're doing oral health, dentistry outreach with our patients. We even have one member that dresses up at the tooth fairy and goes to the various school programs. I mean, just amazing outreach. I would say every bit of 75 to 80% of our outreach is now related to the community health corps program. So to teach these navigators, to prepare these navigators to be the future leaders of healthcare, you really have to start out with a couple of different of the items in the infrastructure, a lot of which is provided by the community health corps program. So first of all, position descriptions, having those positions describe what you want to accomplish out in the community. And you get a lot of that by your community needs assessment. So your community sort of tells you what you need to do for the community, what the community is needing. You prepare your job descriptions, your position descriptions based on that. And then the final piece, very frankly, is recruiting really well towards those positions. And we're very blessed in our community. We have a large university presence and a large presence of folks that have the heart of a servant, that want to reach out and do good things for the community. And so if you put all that together, a good group of folks that want to do the right thing and good positions that will meet the community's needs, it all comes together really well. I probably wouldn't miss a NACHC conference. Our health center, as a clinic that serves the vulnerable of our community, we've been around for almost 40 years now, but we've only been a community health center for the last 14. Clearly, at the moment we decided to go ahead and invest in becoming a NACHC member, which wasn't from the beginning initially. We didn't think we could afford it. Now I would tell you, as the Chief Financial Officer, I don't think that we could afford not to do it. I think the investment that we make in our community health corps dues and in our participation in our NACHC dues and our participation in all things NACHC, I think that's made us a much better health center for our community.